Golden Canopy Health Management channel. My name is Kevin Lee, and today there are some big changes in 2025 that we need to go over for your Medicare Advantage plan. So, did you know a lot of people are leaving money and benefits on the table with their Medicare plan? Well, many seniors don't use all the extra plans and extra features that come with their Medicare Advantage plan. But in 2025, Medicare is making some big changes to help you get most of your coverage. So the first changes that they're making is what's called a mid-year notice on unused benefits. So if you have a Medicare Advantage plan, keep an eye out on your mailbox between June 30th and July 31st, 2025. You'll be getting a mid-year enrollee notification of unused benefits. Mouthful, sorry about that, but I don't come up with the cool titles. So this letter lets you know exactly what benefits you haven't used yet. Benefits like vision and dental coverage, hearing benefits, fitness programs, and a lot more. Many people don't realize they have these benefits, and insurance companies count on that. So a survey found that 3 out of 10 Medicare Advantage members don't use their extra benefits. But now Medicare is making sure that you are aware and you know what's available so you can actually use what you're paying for. So that's the first thing. That's the new big change for 2025. The second thing is lower cost prescriptions. Now let's talk medications, right? Because let's face it, prescription costs can be a pain. But starting in 2025, Medicare Part D will allow insurance plans to swap out expensive brand name drugs for biosimilar mid-year. So biosimilar drugs work just like original drugs, an original medication, but just cost less. And they're typically used for conditions like diabetes, arthritis, and cancer treatments. What this means is that you can get lower cost prescription faster without waiting for the plan's annual update. Another big change that's happened in 2025 is that more mental health professionals can now join Medicare. Now, if you've ever had any trouble finding a therapist or a counselor who takes Medicare, this could help. New providers that are joining are addiction counselors, licensed mental health counselors, and even marriage and family therapists. Another thing that they're doing is Medicare is also cracking down on what's called ghost networks. Now, these providers are listed in most people's plans and networks, but don't actually take new patients. Now, by doing this crackdown, this should make it easier for you to find real available mental health care who actually need it. So that's the third big thing happening in Medicare. The fourth big thing happening in Medicare is prior authorization changes. Now, if you've ever had to fight with insurance over getting a procedure approved, you know how frustrating prior authorization can be. But here's another cool big change. In 2025, Medicare Advantage plans must publicly review how these policies impact at-risk patients. Then, in 2026, insurers will have to respond to prior authorization requests within 7 days instead of the current 14 days. Now, that means faster approval and fewer delays in your care. Now, it's not happening immediately, but the ball has started to roll, and by 2026, it will have a much quicker turnaround for those of us who have been fighting and who have fought in the past for prior authorization. Now, the bonus thing that I want to cover about the big changes in 2025 are for families dealing with dementia. And there's good news, right? Medicare is launching Guide. And Guide is a program to help dementia patients and their caregivers keep loved ones home longer. This program will offer support starting in 2025. So as a review of what the big changes are the first is your mid-year notice of unused benefits. The second is lower cost prescription. The third is more mental health providers are now going to be able to start partnering with Medicare. The fourth is prior authorization changes. Now it's going to be easier to go through that process. And the fifth one is dementia support program. Now, there's a lot of changes in 2025, and I want to make sure you're prepared, which is why we are offering a free 2025 Medicare guide. So please hit the link, download our free guide. And if you have any questions, please don't hesitate to reach out to anyone at Golden Canopy Health Management, or you can reach out to me directly. And thanks so much for stopping by and watching our channel. See you next time. Thanks.